Well, I think that's at the heart of our project. Is the need is just growing rather urgently every year, and we won't meet that need. The gap already is big enough. We can't meet that need by the number of new providers we're turning out as palliative providers. So we will have to find ways to promote primary palliative skills in the hands of the primary and specialty providers.
I think we need to use the curriculum that we've pilot tested and developed in order to make this available to multiple specialty groups, multiple primary care physicians and nurses, because this palliative care is provided interprofessionally. And I think in order for us to fulfill the demand that's out there, that the specialty palliative care providers can't handle it all. We need to include others to do the primary and the most basic of palliative care.
I would add, increasingly, a lot of the hospitals across the country are looking to palliative care to solve some of the problems that are pressing: readmission rates, mortality statistics. And the denominator for those problems are just way too big for palliative services to meet those needs. So this is another reason why we've developed this curriculum, the ADLS curriculum, to bridge that gap.
And I'll just add, one of the things that we tried to do is find a platform that would allow us to reach more people instead of obviously doing the intensive training in the live. So what we've tried to do is pull together a curriculum on a platform that can be scalable on a much larger scale and totally portable. And the one piece that we have in the works is developing a train the trainer model or modules so that we can actually train champions at different organizations to do the live interactive communication pieces, so that we get not just the symptom management and the content areas, but also really skills-based training.
I think we're just hitting this at a time of need. I think every place where we've talked about this, it's resonated, and particularly because it's just centered on what patients and families want, what the health system needs right now.
It's also been about the synchronicity of our vision, and our vision has been to come up with a program that is what we call a card-carrying advanced disease life support, ADLS, which is based on the model of ACLS or ATLS, which are other models that require regular retraining and regular recertification. And we believe that advanced disease, complex disease, chronic disease needs it as much as the trauma patient. I would say we've been thinking about it for many, many years, but it's only been about the last 2 that we have come together, and the curriculum, the idea has congealed, so to speak, and started to come together. It was made possible by a grant that we received from University of Virginia called the Jefferson Trust, and so we were able to develop it and pilot test it over a year, and now we're at the phase where we're wanting to push it out there and to make it more accessible to other people.
Ken's in the School of Nursing and I'm in the School of Medicine, and when we met 4 or 5 years ago, we both discovered that we had carried this dream, had the same dream about this course, completely from independent journeys. And we've been working on it ever since, formally, in the last few years. And then getting Elizabeth on board has really breathed life into the project. I'll say first, I think a central theme is that this was specifically developed as an interprofessional curriculum. That resonates with people. This is a discipline that we have practiced, all of us, interprofessionally, but we're not teaching it interprofessionally. And so that's novel, but it shouldn't be. I'm hoping that this will be a project that fosters a lot more of that going forward.
I would add that it's for a patient-centered, best care possible, the best care at the right place at the right time. It's always about the best care for our patients. But there are also environmental pressures out there to get patients out of the hospital, to get patients the best care so they're not readmitted too quickly back to the hospital, and so that they die where they wish to die, which for a lot of people that's at home with their loved ones, their families, their pet, their favorite chair, wherever. That's our goal, is to give the best care possible.
Well, we're preaching to the choir here at the Assembly, but we have purposely developed this curriculum as a model of train the trainer, because ultimately we'd like this to be part of change and culture shift in the healthcare systems that it's carried back to. And for that to happen, you really need champions. And so we would hope that we will recruit champions from our palliative community and outside of it, to affect change, to help this cascade down into much larger groups of nurses, physicians, and I think eventually we'd like to extend that to other disciplines as well.